There are three causes of antepartum hemorrhage. These are abruptio placentae, placenta previa, and vasa previa. In regards to definition, abruptio placentae is a sudden rupture of the placenta in the third trimester. It can lead to a retroplacental hematoma. Placenta previa consists of an abnormal placentation, namely the placenta overlies the cervical os. Lastly, we have vasa previa, umbilical vessels underlying the cervical os, or a filamentous umbilical artery. The risk factors for placenta previa are represented by hypertension, preeclampsia, cocaine or smoking, trauma, and previous abruptio placentae. On the other hand, the risk factors for placenta previa are represented by multiparity, advanced age, previous placental abruption. The risk factors for vasa previa are multiparity, in vitro fertilization, single umbilical artery, placenta previa, and low-lying placenta. The diagnosis for abruptio placentae is made on a clinical base. In comparison, the diagnosis for placenta previa is done with a transvaginal ultrasound that will show the abnormal placentation. Vasa previa is diagnosed with a transvaginal ultrasound, but it uses Doppler. On the USMLE, there will be different clinical presentations of these antepartum hemorrhage etiologies. Firstly, we will have to differentiate between abruptio placentae and the other two. We can differentiate it by the nature of the bleeding. Abruptio placentae will present with a painful bleeding, whereas placenta previa and vasa previa will present with a painless bleeding. In regards to the clinical presentation, we have to differentiate between vasa previa and placenta previa. In the case of the placenta previa, the question stem will say that it ceased to bleed by 1 to 2 hours spontaneously. In the case of vasa previa, the question stem will show bradycardia of the fetus with a pulse lower than 110 beats per minute. Also, the bleeding is associated with the rupture of membranes in the case of vasa previa. If you find useful this USMLE information, consider subscribing to be notified about new upcoming educational videos. On the USMLE, you will be asked what is the best next step for each one of the etiologies. In the case of abruptio placentae, if we have a moderate to severe abruption, we will opt for delivery. If the fetus and the mother are stable hemodynamically, we will opt for a vaginal delivery. If the fetus and the mother are hemodynamically unstable, which is very frequent on the USMLE questions, then we will opt for a C-section. In the case of the answer for the management of placenta previa, we will opt for a conservative management. The treatment of acute bleeding in the case of vasa previa is represented by C-section. However, if the ultrasound identifies vasa previa in the second trimester, then the patient is given betamethasone in week 28 up until week 30. She will be hospitalized between week 30 and 32, and she will deliver by C-section by week 35. Another frequent detail asked on USMLEs is the complication of each condition. There are 3 complications that come with placental abruption. Firstly, the mother will develop DIC. Secondly, there is the fetal demise. And lastly, we have a shock-like state. For placenta previa, there are 2 main risks. These are premature delivery as well as an increased risk of placental abruption. The main complication of vasa previa is fetal exsanguination, which will lead to fetal demise. If you want to support growing the channel, consider becoming a patron. The link is in the description below.